Thank you both, Katina and Ariella. So what we'll do now is we'll have a panel discussion with our previous four presenters, moderated by Dr. Willis. We'll then have a moderated, a roundtable discussion with the roundtable members and perhaps sometimes from the audience. Dr. Willis is a Kellner Professor of Pediatrics, Director of the Center for the Advancement of Underserved Children, and the Director of Health Equity and Urban Clinical Care Partnerships at the Medical College of Wisconsin. And Dr. Willis is also a member of the roundtable. So we'll have time for questions, as I just said, after the panel. Earnestine?
Thanks, Bernie. The panel has already been introduced, and I think we can move right into the discussion. But I also would like for all of us to thank the panelists for sharing their community-based perspective and some of the initiatives that they have embarked upon. My first question goes to Katina as well as Marissa and Leslie. Would you help us with understanding how you went about, and I think, Katina, you elaborated on this, how you determine priority when it comes to the different stakeholders across the community? The three of you would just speak to that.
So I did talk a lot about how we determine priority communities, but then within communities, how did we determine what priorities we really took on at any time? And we really used a consensus model process, and so we're out talking to a lot of people. They're all feeding to us what's important, and we have to put those things in perspective. We know that we can't do everything together immediately, but we can put those things all on the table, we can line them up, and we can sort of sequence them. And so what we tried to do is come to agreement with them about what makes sense now with a short period of time, what can we then do actively to get more funding, to do more overtime, and how do we line those up in a way that's logical from both a funding perspective but also a time perspective, because what we also found is that so many of our community partners had such limited time to contribute to these activities because, again, this is not their only work or their real job. And so we really had to think about their bandwidth and what they could do now and what they want to do later. And so it got really clear quickly, as long as we were just staying in conversation and relationship and hearing them say, this is what we want to do and when and how and help us.
Can I follow that up by saying, can you tell us whether or not your priorities of where you went in, did it change over time from the feedback that you got from them?
So it's funny, our priority, so I come from a background of community engaged research, and I did HIV prevention and drug abuse research in communities for a long time, and in those communities, this sort of ground up perspective is really integrated. And so my priority was only that I wanted to go into communities and help them figure out how to do the work that was important to them surrounding health and health literacy and wellness. And so the strategies weren't predefined for me. I just knew that we have some things that we know that work, and we want to do those things, and we want to make sure everybody gets everything they want to the best of our ability to provide. But it didn't actually matter to me if I gave them teach back or there are some things I can do easily. So we have lots of writers and we have lots of health literate materials that are available, and that's very quick for us. So if anybody mentions that ever, we can sort of respond to that quickly and sort of go on to the next thing. But short of just giving them everything we have that they need in the most efficient way possible, I didn't actually have a huge agenda, although it didn't surprise me to learn the things that popped up in their agendas. And it's just really interesting to see across communities, as we talk, they all are interested in the same sorts of things. How do we put this together with food, and how do we connect this to our visits, and how do we learn to make decisions in stressful situations? That's across the board what people want. It's how we give it to them and how we sort of layer that in their space. I think that becomes very culturally focused at the culture of the community.
Also, I'd like to agree that as far as how we develop priorities was on a consensus basis. But in what I had mentioned earlier, that we had utilized a PBS documentary series where we went out to local communities, showed the documentary, and we were able to ask some specific questions afterwards. So at every audience that we went to, we asked the same specific questions. We also picked up on some demographic data, but we also found that as we did these different presentations, we were being asked to come to communities to present it. And again, the different segments within, one in particular where we looked at the health ranking of that particular community by zip code. That was very important in engaging the community in, again, what was important to them. And the documentary, though, was so interesting in how the different players within the documentary were speaking to that themselves. Again, it just involved the participant into answering those questions. And I think from that point forward, they engaged in other coalitions, which we encourage on the local level, but they engaged with us on a statewide level. And those particular comments that we received helped to, again, drive what we were looking from a statewide broad-based level. And we provided that information on to other groups that were looking for public comment.
Well, Katina took my answer, so no. Our grantees were asked to base their priorities based on the county needs, looking at the State of Health report, and to work with their partners to determine specific programs, and then use feedback from the participants of the community to then adjust their programs and resources or repeat certain things that were highly successful. So we did not tell them what their priorities were, but we told them where to find the resource that would help guide that. Our overall project at the Department of Libraries, our priorities have not changed. We wanted to provide resources so that public libraries could become active, visible, and effective partners in health literacy. We're not trying to, become the health literacy experts of the state necessarily, but we want to be partners in that. And we want Oklahoma children, adults, and families to get additional resources and access to information to help improve their health. So those are our two overarching priorities.
Thank you. The next question I wanted to direct to Ariella and Katina and Leslie also. The next panel after us, we will hear more about evaluations of interventions, but briefly, when you began your initiative, did you think about evaluation, and did you feel you had adequate tools to evaluate your programs?
That's a tough question. First of all, I'm a statistician, so evaluation is on my mind always. When we started our project in 2001, we decided to create evaluation surveys in the different prevention topics. And we had the luxury to go and see how these projects are implemented. And when we saw that half of the families did not fill our surveys, we understood that we had something very wrong. The level of literacy was much too high. A survey that was 7 pages long became 1 page now. So we really grew our evaluation method with the feedback from the agencies. And I think one thing that made a strength to our evaluation is that after every cycle, we share with every Head Start grantee their own data that they can then use in the community, and they can also learn from it. So that way they learn and we continue to learn. So we're not done yet, but we continue to refine our evaluations as we go.
Would you speak to the tools also? Do you think you had adequate tools?
We did not use health literacy evaluation tools. We assume, given our original study, that since Head Start families would live in the trash materials that were 7th or 8th grade, meaning they couldn't understand them, that if we would reach a lower level, we would do. So we developed our own evaluations, and we added to it the tracking of behaviors and tracking of emergency room, using Head Start Child Plus data to track attendance and so on.
So we also started at the beginning thinking about evaluation, and to get to the end, we didn't think we had the tools. So we had the intellectual tools and the relationships, but there wasn't anything sort of on a shelf that we could pull and make it work. The communities were so different and so diverse that we really had to create. We're lucky that we live in a time of technology, so Google Forms and iPads and all these things facilitated quick creation of materials that allowed us to collect a lot of data sort of in real time in communities, and we can record conversations and keep forms of who we talk to and how long we talk, and we can code the activities and follow up with all of those pieces. Getting to behavior change is a little bit more complex in communities like this, because the question then is, like, whose behavior are we measuring when? And all the people around them behavior also change. So if you give a little intervention dose here, you got to measure all the people around it. And we're not as great at that right now as we would like to be. And we don't have all of the resources because it costs a lot of money to do that. But, you know, sort of the name of the game in this, too, is just to be thinking about it and asking the questions. And so you ask the question, you think about it, you talk with the communities about what you're going to do, you build what you can, and sort of do your best as you go along, I think. I think the tools are really weak everywhere. But in community work, I think it's really hard. It's really hard to find a good tool that works just as is for every sort of question and problem. And I think, you know, hopefully some people will give us some guidance a little bit later in the day about some things that are robust and usable as they are.
Evaluation is also part of our project. However, it's based on the requirements of our funder. So each of our sites for every program that they offer get feedback from all the participants, or as many as they can get. And then that information is submitted in the final report for the entire project. It's pretty minimal, but I would say for our purposes, it's what we need to do. Additionally, we ask each site to come up with 3 measurable outcomes for their project and report based on what they started out trying to accomplish. So they do a little bit of that. But I think there's always opportunity and a need for more tools to evaluate these projects. I would love somebody to come to Oklahoma and do that.
Marissa, you want to respond to that?
Yes, I just wanted to say that our coalition didn't receive any direct funding where we had to meet certain directives, but based on the participants, our partners, we utilized the roundtable's 10 attributes of a health literate organization. That those attributes are kind of what we had utilized in our evaluation tools to, again, ask of those different providers out there how they were doing their work. And so those are, again, some wonderful ways to establish some baselines.
Next question I would like for the Marissa and Ariella, as well as Leslie, to speak to is what are some of the strategies for transitioning from laying the groundwork to community awareness as well as capacity building within the community as related to your program?
Okay, thank you. From a coalition standpoint, I mean, we just started with building our capacity in our communities, and that's looking at the individual living in the community as well as those that are providing health services. And again, building that capacity of individuals that have that interest, that would be willing to volunteer, not really having grant funding that would determine whether they participate or not. It was whether they had the interest in seeing health improved in our communities. So we did have that coalition building, which took a lot of years, a lot of sharing of information about how our different social determinants impact health. And our steering committee members actually were those individuals that represented those different sectors. And again, I can't say more than enough that they were volunteering their expertise and time because of their commitment to wanting to see health improved across the communities in Oklahoma in their own capacities within their organizations, whether it was on the local level or on a statewide level. And you know, within the organization I worked in, we had to find key champions that would help us take the information in addressing health equity, because again, we started with looking at health equity and then how the social determinants impact health equity. We had to find those champions that would actually help us administer a survey within our institutions, get some information within, and then be able to provide a training or trainings that could be provided to the organizations that within our system. So that was very critical in taking it from awareness building to actually integrating it into our institutions or our agencies.
Thank you. Well, first we had to tell librarians what we meant by health literacy. That was the very first step. And thanks to Dr. Andrew Pleasant, 6 years ago, or almost 7 years ago, that helped do just that. And we took that initial meeting and started our project shortly after. Part of our helping them along the way is to have somebody that they can call for questions. So that was me. So I learned as much as I could about health literacy by going to different conferences. I went to the IHA conference and the Wisconsin Health Literacy Conference and did a lot of research so that I could provide some information and assistance to these grantees. Then I thought it was very important, since Oklahoma is a large state and a large rural state, that we communicate between the sites. So we hold regular conference calls where we bring them on and they can share ideas, problem solving, best practices, and things like that, which has been really a great resource for me and for them. Then we do presentations and let them present some of their successes, like at the Oklahoma Library Association conference, have the librarians involved talk to their peers about what they're doing, and then that word starting to get out. We also present things at the Literacy Conference and have done presentations at the Oklahoma Health Equity Campaign meetings that are broadcast to most of the county health departments in the state. So the word is really getting out through a variety of ways. And then the last thing I do, I think that's been very helpful, is to provide opportunities for them to get continuing education in health literacy. So we've had the 3 summits that we talked about, and we're getting ready to have another one at the end of August. Dr. Pleasant's been to our state 3 times. We've sent on 2 or 3 occasions scholarships for our people to go to the Wisconsin Health Literacy Summit. And then next month we're bringing in Sabrina Kurtz-Rossi to do some training for health providers and literacy providers and library staff on plain language. And also bringing in our colleague from the National Network of Libraries of Medicine. So providing them with information and education as this world of health literacy is just exploding in Oklahoma. Thank you.
We had the luxury of having the first 6 years of our project, the funding from Johnson & Johnson, who really allowed us to start very small. We started with 200 families. It took 15 years to get to 130,000. And we're very lucky that we worked with such a creative and innovative environment such as Head Start. So every year we would go and see the training, we would get feedback, we would hear about challenges, about successes, and we would enrich our curriculum with all these stories. So in 2008, we have been already in all 50 states and saw how this program has been applied in different communities. And this allowed us to apply to the innovation grant for the Office of Head Start. And from there, and knocking multiple times at the doors, health literacy became part of what they do and how they can do better what they have to do anyway, which is provide comprehensive services to the families.
Well, you heard this morning from the position paper in the scope and review method that they found few programs that address sustainability. So I wanted to know, how did you develop and sustain the resources to implement your interventions in terms of funding staff as well as volunteers? And I give that to Leslie and Marissa.
Okay.
Right here.
Well, I've talked about this grant, these funds that we've gotten, and that is from the Library Services and Technology Act funds from the Institute of Museum and Library Services. LSTA funds from IMLS, so if you're in the library world. These are federal dollars that are given to state libraries, and these agencies can use the money to fund projects that address their 5-year plan. So that's one of the reasons it's a good idea to get the state libraries to think about health literacy and get some type of mention in the 5-year plan. The health literacy projects that we do happen to address at least 3 of the LSTA priorities, so that's a pretty good match. We've had a budget increase for this project every year since I started, and so more and more emphasis is being placed and more priorities being placed on this project. My agency also allows me to dedicate an increasing amount of time and effort into this project because it's grown every year for the past 6 years and starting to launch the 7th year next month. As far as the grantee sites go, they use a mix of paid staff, library staff, volunteers, and paid presenters. They also network with their community with the literacy programs there. They have been so highly successful in getting in-kind and community support. I had one grantee call me after we talked about a project that called me and said, never mind, I don't need the money because our community is donating everything. So there's a lot of other organizations interested in health literacy that are looking for partners, and they want to provide, and they can provide their services at no charge. So in some of our sites, actually, spending the money's been an issue, so that's quite interesting. Sustainability, our grant funds from IMLS, happens to be on the list of agencies that could be eliminated. So that will provide a lot of challenges and opportunities for our sites and for our office as well.
And our coalition, really, like I said just a few minutes ago, we don't have any direct funding that's supporting us. Now that the steering committee members and the things that have changed as far as budgetarily in our state with our public resources, we're going to a nonprofit status. So with that in play, we are hoping that we're going to actually be able to expedite our efforts working with the Department of Libraries and other public and private organizations out there to do more as time goes on. But in the years past, we have really sustained what we've been doing and have grown our coalition because of the in-kind contributions of our volunteer partners. Without them, their expertise and experience, like I said, and the multiple hats that they have in being involved in different organizations, both on a local, state, regional, national levels, it has helped us so much to be able to do what we've been doing to just bring people together, because in Oklahoma as well as in other states, we have a lot of issues in being able to move forward because, of course, lack of funding, but then lack of awareness and understanding of what is taking place in our state and kind of processes in place, understanding what's going on in transportation and housing and all. And so our efforts, how we're bringing in those resources and those opportunities is by focusing in on not only literacy, which we see as a primary determinant and a primary issue that we're addressing, but we have been addressing and working with entities within housing. And so in April, we had a Fair Housing and Health Summit. And our campaign members are the ones that were brought together along with new members, looking at our realtors, looking at others. And as was mentioned by Katina, we're not talking specifically about health equity or health literacy when we're bringing together different experts to provide information, but we are talking about health and how we want to see health improved. We also want to see those individuals being able to be more productive in the workforce. And at this point in time in our state, as well as other states, we're looking at the critical issues we have with having health providers out there in our rural communities that can help meet, again, the population health issues that we have right now that are hopefully are not going to continue to get worse, but again, the factors involved make it very challenging. So health literacy is key, but working with our non-traditional health partners have been one of the best things to leverage our resources and opportunities in Oklahoma.
Thank you. Can we bring Katina and Ariella into the discussion? I'm going to change the question. When we surveyed other audience that's interested in health literacy intervention in their community, we heard back that time is also a crucial issue and a scarce resource. So did it take longer to build your program than you expected? And how is time a factor for you, both of you?
So we got funded in May to do this, and we had a long-term relationship with Missouri Foundation for Health. And we had conversations from January to May about what was going to be in our proposal, and we were all on the same page, and they were excited, and their board was excited. They gave us money in May, and they said, okay, well, now tell us again what that means. And these are really smart, competent people who do community work, and they get communities. But tell us how you're going to do that, and tell us what that means. And it's got our name on it in all these places, and so we need to talk about the branding and the relationships and who's out front and who's not. And so we spent from May until September working through that little piece of paper that I showed you that you're like, why don't you put that up there? Because that represented, a third of year one just with the funders to get to the page where we said this is how we're going to do it and how we're going to talk about it, and we're not really going to use logos because we don't want logos on top of other logos to confuse people about logos, but we've got to have some coordination about communities so that they know that there's really a thing here and there's an effort and that this is not sort of a fly-by-night, random group of people coming in. And those politics were really complicated, and that was just getting us to the community. So then we picked our community, and then we had to get them to pick us back. And I can't even talk about how much conversation it was about what that meant, that they could pick us back. So this idea that they get to then pick back, and they could say, you know what, like, we're sort of busy and we've got that, and we don't even want somebody from St. Louis come in here to tell us a thing that we already know. We're not into that. And they didn't, but I think they didn't do that because we did it the right way. Right? So if we hadn't given them the chance and we said, you're our community and we're going to do this, we're going to bring you health literacy and we're going to fix all your health problems, we would be in a really different place with them in relationship and also the activities, and it wouldn't be a real thing, right? So we'd be going there and spending money, but we wouldn't be solving their problem or working with them. And so that got us all the way through half of year one, and then we really got to start our work. And so we started to go to the communities and do the work, and they started to tell us what their issues are. And that's the reason that I don't have clear things to talk about in evaluation and implementation, really, actually. So I can tell you what they said and tell you what they wanted and tell you what the strategy started to look like, but I can't yet tell you how it worked because we're not even all the way through one cycle of how it worked and what that meant, because it takes so long to do it. In the middle of that, it's sort of a moving target of what's next, which is really the magic, I think. And so this is beautiful and creative and flexible and all of this stuff. It's also a little bit painful because in the middle of all of that stuff that's just on the funder side and the politics side, you get to these places, and as I've said a couple of times, these people are actually doing their real work, which is not our work. And so making us fit into their schedules and getting them all together for meetings and figuring out how to have these conversations that aren't quick and easy conversations really is complex, and so time does become important. But I appreciated on all the slides people talk about sort of the importance of sort of relationships with people you like, being asked questions, being able to be engaged in solving the problems, bringing food. We're constantly trying to get people to have coffee with us and lunch with us and all these things because those are the minutes that they sort of have, and if you can be relational and personal in that place and feed them too, you can get a lot done. And so make use of the time you have. It's hard, though. I hear that.
Well, I feel this question very strongly, but we've had 15 years to work at it. And it does take time. I mean, we use the time to learn from the different communities, although we talk about the Head Start community, but it's a national community and very different according to their locations. But I believe that with time, our resources were varied enough to satisfy the needs nationally. And the demand that we have now is much higher than what we can provide. I believe that after 5-6 years, Head Start agencies have realized that we really help them do better what they have to do anyway. And they wouldn't be in this business if they wouldn't care about children and families. And the fact that we shared the data with them and that they could share it with the families, the Policy Council, the Health Advisory Board really made a difference. But we reached 140,000 families. There are 1 million families, so we're not ready to retire.
Okay. I'm going to put this question to all the panelists, and I think we have time. Thank you. I think I'm going to put this question to all the panelists, and I know we have time to give each one of you a chance to respond to this. Were there successes that didn't go as successful initiatives that didn't go as planned? And if so, what did you learn from that during this development and implementation phase? So all of you want to speak to that. So you want to start?
What we learn over time is that there's no cutting corners. That when you don't do it intentionally the right way, you will not have the impact. And we did try, because we did have some funders that asked us, can you just distribute the book and measure the impact? Can you just do your training without distributing the book? And we didn't have the same impact. So it needs to be planned and intentional.
I think I'd say the same thing. I talked a little bit about successes or processes that ended up okay but didn't go as we planned. And you know, in communities, I always think that it's an evolution, and you're sort of always you're just always moving with them, and you're moving together. So many things don't go as planned, and it all sort of turns out okay as long as you're still there together on the other side. So I think one of the key messages that I didn't talk about in my slides that I maybe should have is this idea that you know, who you are and who you bring to their community really matters, and that sort of humility and sort of humbleness and the flexibility about you're also there because you recognize that they're the experts, and you have this little narrow thing that you do that maybe can help them. So you have some resources from a funder, or you know, a little thing about health literacy that maybe amplifies all the other things they're doing, but that's sort of it, and they have everything else there, and maybe you can help them see some things that they don't see, but that's sort of it. So if you just come there and you start in that place and you work through it together, the bumps are part of it, and it's okay, and everything is sort of unknowable, sort of.
We have not had anything that didn't go successfully. It's just been highly successful. I know something's out there probably. So I'm not going to talk about something that didn't go successfully, but I want to talk about something that's going to go successfully on Monday. In order for me to come to this, and it's a result of being here. As a result of me being here, I had to get permission from our cabinet secretary for out-of-state travel because of Oklahoma's budget problems. And so I got a call from his office saying he wants to meet with me on Monday for an hour to talk about health literacy, what came out of this meeting, and what I had to share about Oklahoma Public Library. So I'm hoping that this will be another big success. Thank you.
And as far as the Oklahoma Health Equity Campaign, I think that as far as I had mentioned earlier, that in 2008 is when we came together, and in 2011 we really had a focus on health literacy. I think all those years since that time, of course, we have always been optimistic about what things were going to be impacting our state, the decisions of the different people in leadership in our state. We, you know, again, depending on your perspective, would like to see things go one way versus another. But as a result, I mean, we've had to change what we're doing. But again, in addressing health literacy, which is definitely, you know, looking at those issues versus talking about health equity sometime, even though we started out with basing everything, looking at things from a health equity perspective. Very important to exchange, again, views and how the different sectors impact health. But health literacy now, with it being a primary determinant of how and what we're going to address, I think we're going to see even more movement. And if we can, and with our organization going nonprofit, and also leveraging our relationships and some of the members that we have on our committee, on other councils that are on a regional level or on a national level, and bringing all of those different resources and connections to play, I think we're going to expedite things happening in relation to health literacy and to also advance health equity in Oklahoma. Again, things in Oklahoma seem to come a little bit later than some of the other states, but definitely we have pride in our people. We want to see the health of our state, our citizens improve, and it's evident just by the volunteerism of the different people representing different organizations, not just looking, at public transportation or housing, but, bringing it all together with addressing health. These have been key, and I just really think we're going to see some things expedited with addressing health literacy as our primary determinant.
And I know we should be on our last question, but as I heard comments across the panelists, I was wondering, and Ariella, you brought it up, that you share the data back with your stakeholders, and I was wondering with the other three panelists, how much of shared data is going on in your program and initiatives?
So for us, the data is primarily used to drive what's happening when. So you have to share it so that they can make the next decision. So there's a lot of sort of conversation about, we met and you told us this, and these are sort of the things that are on our plate. How do we put those together and prioritize? So officially, there's not a project report that says this is the data for your community, certainly, but there's a report that says, okay, these are the things we're talking about. What's next? How do we decide together?
And we also have found that when we've had community forums, when we've asked certain questions and we're getting responses from the individuals, we are in real time documenting what people are saying so that they can see what they're saying on the screen. And those reports have been appreciated by the individuals that attend. And we have in 2014, when we had the time for public comment for the Oklahoma Health Improvement Plan, we submitted those particular comments to the Oklahoma Health Improvement Committee to be able to take into consideration. Again, the comments ranged, but that was the purpose of why we come together as a coalition, and we need to be taking those comments and providing them to different entities, city councils, the Oklahoma Health Improvement Plan committees. They need to hear from the people, and a lot of times it's not being seen, but that has been one of the things that have been very successful, is to be able to see real time what people are saying and having it there move forward.
Leslie, that will be the last response.
Plenty of time.
All of our information is shared with our sites, and because it's federal money, it's shared with the world on the final report, which highlights all the statistics from each site and overviews and comments and all that. So all that is available. And the new reports will be coming in August, so I'll be working on the past year's statistics and all that data soon.
We want to thank the panelists, and I hope you all will give them a round of applause.
And thank you, Ernestine, for moderating a very, very interesting discussion. They were very good and scalable success stories. And by the way, Leslie, go Leslie on Monday.